Obesity-related health complications include heart disease, stroke, type 2 diabetes, and certain types of cancer, some of the leading causes of preventable death. The Diabetes Prevention Program, a major federally funded study of more than 3,000 people at high risk for diabetes, showed that moderate diet and exercise of about 30 minutes or more, 5 or more days per week, resulting in a 5 to 7% weight loss, can delay and possibly prevent type 2 diabetes. The team of specialists at Better at Home and Mederi Caretenders know the importance of nutritional education and monitoring for patients with type 2 diabetes.
Our newly diagnosed diabetes patient, they are usually, if they have to have injections, they're nervous about giving themselves shots twice a day. So we'll do the education on the injection. We'll also teach a caregiver in the home. And we can do those injections for a few days until they get comfortable doing that. We will also educate them on their diet and nutrition. I'm, a pretty healthy individual, but I don't understand my complex carbs either. So I can't imagine being 65 and older and having to completely change the way that you eat. So we will actually go through labels, educate the patient as much as we can on their newly diagnosed condition of what to eat, when to substitute certain foods. If they're going to have that piece of cake, then not to eat that bread or that pasta later. So we really try to work with them on the nutrition aspect of that, because that's what usually gets their sugar out of whack, is the food that they're putting in their body, and they really don't understand that. And then the physicians actually have maybe 10 or 15 minutes with these patients, and they think that what they're telling the patient in the office, they seem like they get it, they nod, yep, I get it. They get home, it's like, I have no idea what my doctor just said to me. So we're kind of that reinforcement in the home of what to eat, what not to eat, when to take your meds, how to test your sugar. A lot of them don't realize how to do that. And then what are the warning signs? What do they do when their sugar is a little elevated? We'll walk them through those pieces as well. And then for our uncontrolled diabetics, it's, okay, Mr. Smith, what have you eaten today? It's like, I'm not eating anything bad. We get into the home, peel back the layers of that onion, and we see that they've got candy hidden in the drawer by their bed. The wife is saying, he's eating all this cake and sugar. So we really try to do as much as we can with educating them and making a deal with them. Let's compromise. You can have this, but let's not eat this. Because they're 75, 80 years old, are they really going to give up everything? Probably not. So we work with them as much as we can and through the physician on, okay, what can you live with? And let's talk to them about what they can live without. So it's really a balancing act. And sometimes we get into, and with them, it's just, with the uncontrolled guys, it's education as well. Maybe they really never got that full education on the front end, so therefore they really didn't realize that they were eating unhealthy, that it was really affecting their sugar.
The American Diabetes Association recommends testing to detect prediabetes and type 2 diabetes in adults without symptoms who are overweight or obese and have one or more additional risk factors for diabetes, like having a parent with diabetes or being physically inactive. For more information on the services offered by Better at Home and Mederi Caretenders, click on the Treating Type 2 story link icon on our homepage, yourhometownhealth.com.